Thank you, Alan. This is our first presentation for Dragonfleye Therapeutics. And our mission is really to enable minimally invasive, visually guided delivery of therapeutics to desired locations, specifically the subretinal and the suprachoroidal space, with precision and accuracy, and to be able to do this in the office. Our story, interestingly, started in a completely different area, which is retinal detachment, which is an area of research interest of mine. And just to give you a brief history, why are we looking to change retinal detachment repair? It's because vitrectomy, which is our common technique of treating this, attaches the retina in the wrong position, and patients are unhappy. And this autofluorescence shows the imprints of the vessels and how they've shifted from their original position. We've also learned that attaching the retina in a very rapid manner, like we do with vitrectomy, causes these folds in the retina, which is associated with worse visual acuity outcomes. And we've seen that when the retina attaches in a slow and gradual manner, we get a better, more anatomic reattachment with better outcomes for patients. This led to the development of a novel in-office technique for retinal detachment repair in 2023. This is a patient with Parkinson's disease and a temporal retinal break and a retinal detachment that you see on this OCT. I injected suprachoroidal viscoelastic, and miraculously, the next day, the retina is attached. The patient went to work, they can play tennis, they can do whatever they want. Alan will know that this is a game changer if we can execute this for all patients. And this is at month 7, showing excellent anatomic recovery. The problem is we don't have the device that can reliably do this. I'd like to introduce for the first time our Dragonfleye device, which is a device that has a wheel with a variable length needle. It also has an LED light that allows us to see where we are in the posterior segment. As this needle is being advanced, there's a motor that's pushing the viscoelastic or the medication so that as soon as it enters the suprachoroidal space, the gel will automatically flow into that suprachoroidal space. Here's an animation video showing how the device works for retinal detachment, but can be used for any therapeutic delivery, both suprachoroidal and subretinal. We have a light that shows us where we are. The needle is advanced. As soon as the needle hits the suprachoroidal space, the motor's already pressurized to inject this viscoelastic. That functionally closes the retinal break, and the retina attaches in a slow and a gradual manner, avoiding many of the adverse events that occur with common retinal detachment repair procedures today. And remember, no tamponade, no positioning. Here I would like to show you for the first time how I have used this device in pigs. So we can do the procedure with both an indirect or wide field viewing, but it's designed to be an in-office treatment for suprachoroidal and subretinal therapeutics. Here you see the red light indicating where we are. Now watch very carefully. You're going to see a bleb of viscoelastic being precisely injected into the suprachoroidal space. This is something, as a retinal surgeon for 15 years, probably one of the coolest things I've ever seen. Here you can see the bleb underneath in that correct space. Here's another example where I'm injecting 0.6 mLs of sodium hyaluronate, and here's the bleb that's formed. And afterwards, I immediately dissect the eyes, and you can see the bleb down below there. And what I'm doing is I'm separating the choroid from the sclera. And you're going to see I'm just going to push on the retina just to show that that viscoelastic is beautifully in that space between the choroid and the sclera. Now, what about drug delivery? We're using ICG as our model. Here's the red light, and there you saw the ICG going into the suprachoroidal space there. And we use, and here's a picture showing the bleb, and then we have a blue filter on the OCT showing penetration into the suprachoroidal space. Here's another example where 0.3 ml of ICG was injected very close to the macular region. And you see the bleb forming there. And again, with the, and here you can see kind of the greenish hue. It's a little bit hard to see, but the greenish hue of the ICG spreading everywhere. And with OCT, with the blue filter, that bright area shows you where the ICG has been, very close to the macular region. So I just want to leave you that I think we are going to change the delivery of therapeutics in office for suprachoroidal and subretinal treatments. And here's our drug delivery platform that we think is going to be a game changer for gene therapy and other therapies. Thank you very much.
Impressive. What's your next steps? What are you looking to do?
Well, I mean, we have two parallel paths. From a commercial perspective, our main objective is to develop preclinical data, proof of concept data that can show that we can deliver various agents and demonstrate efficacy and safety in a preclinical model. In terms of retinal detachment, we're a little farther ahead. It's obviously a smaller commercial market, but we are ready for first-in-human studies in about a month or two from now.
Congratulations.
What kind of funding are you looking for?
So we have seed capital from the founders. We're doing a $10 million raise, which is oversubscribed at the moment in June.
Okay. Congratulations on that. Thank you.